Below is a detailed, expanded explanation of the 12 major differences between potassium chloride, KCl, tablets and sodium bicarbonate, NaCO3 tablets. Each point includes definition, mechanism, clinical significance, and examples for full clarity. Number 1. Chemical composition. Potassium chloride KCl, made of potassium K-pi and chloride Cl- ions. Potassium is a vital intracellular cation involved in nerve and muscle function. Sodium bicarbonate, NaHCO3, composed of sodium, and bicarbonate, HCO3's ions. Bicarbonate acts as a major extracellular buffer in acid-base balance. Significance. KCl affects electrolyte replacement, while NaHCO3 affects buffering and sodium levels. Number 2. Primary therapeutic use. Potassium chloride, used for correction and prevention of hypokalemia. Hypokalemia may result from diuretics, furosemide thiazides, vomiting, diarrhea, hyperaldosteronism. Sodium bicarbonate, used to treat metabolic acidosis and conditions involving excess acidity. Common uses: chronic kidney disease, poisoning cases, e.g. tricyclic antidepressant overdose, acid indigestion and heartburn. Meaning, KCl restores potassium, and HCO3 restores alkaline balance or neutralizes acid. Number 3. Mechanism of action. KCl replenishes potassium used by an AKK-ATPase pump, cardiac muscle, skeletal muscle, neuronal activity, helps maintain normal electrical activity of the heart. NaHCO3 releases bicarbonate, which neutralizes H-acid, increases blood pH, reduces acidity in stomach and bloodstream, meaning KCl replaces a deficient ion, and NaHCO3 modifies the acid-base environment. 4. Effect on acid-base balance. KCl generally no direct effect on acid-base balance. Excess KCl can cause mild acidosis but rarely clinically significant. NaHCO3, strong alkalinizing agent, raises pH of blood, urine, and stomach contents, used in metabolic acidosis, urinary alkalinization, meaning NaHCO3 directly changes pH, KCl does not. Number 5. Electrolytes supplied. KCl provides KQ, a major intracellular cation, helps regulate muscle contraction, heart rhythm, nerve conduction. NaHCO3 supplies Na- extracellular cation, HCO3- buffer for pH regulation, meaning KCl impacts heart and muscle function, NaHCO3 impacts sodium load and pH. Number 6. Typical clinical conditions treated KCl. Used in hypokalemia from diuretics, digitalis toxicity correction, chronic diarrhea with potassium loss. NaHCO3 used in metabolic acidosis, renal failure, hyperkalemia shifts case into cells, RTA, renal tubular acidosis, indigestion from excess acid, meaning KCl treats potassium deficiency, NaHCO3 treats acidic conditions. Number 7. Formulations. KCl formulations, extended release tablets, capsules, oral solution, injectable solution, hospital use only. NaHCO3 formulations, tablets, effervescent tablets, powder, IV form for severe acidosis, meaning KCl often uses extended release forms to prevent GI irritation. NaHCO3 often uses effervescent or powder forms for rapid dissolution. 8. Major risks and toxicity. KCl, hyperkalemia, which can cause muscle weakness, cardiac arrhythmias, cardiac arrest. Patients with kidney failure are especially at risk. NaHCO3, metabolic alkalosis, fluid retention due to sodium, hypernatremia. High doses can cause tetany, muscle twitching, and vomiting, meaning KCl overdosing affects the heart. NaHCO3 overdosing affects pH and fluid balance. Number 9. Gastrointestinal effects. KCl gastric irritation is common. Nausea, vomiting, ulcers, esophageal irritation if swallowed dry. Extended release forms help reduce irritation. NaHCO3 produces gas, causing bloating, belching, stomach cramps, meaning KCl may damage GI lining. NaHCO3 causes gas-related discomfort. 10. Effects on kidneys. KCl. Kidneys regulate potassium, impaired renal function, dangerous hyperkalemia. Must be avoided or carefully monitored in renal disease. NaHCO3, often used in kidney disease to correct acidosis, but sodium load may cause fluid overload in renal heart failure, meaning KCl is risky for kidney patients. NaHCO3 is often beneficial in kidney acidosis. 11. Drug interactions. KCl interacts with drugs that retain potassium, ACE inhibitors, enalapril, lisinopril, ARBs, losartan, aldosterone antagonists, spironolactone, potassium-sparing diuretics, amiloride. Risk: severe hyperkalemia. NaHCO3 alters absorption of pH-dependent drugs, weak acids, aspirin, some antibiotics, antifungals. Can cause milk alkali syndrome when combined with calcium supplements, meaning KCl interacts mainly via potassium and HCO3 interacts via pH changes. Number 12, taste and palatability. KCl, bitter, metallic taste. Tablets often coated to mask unpleasant flavor. NaHCO3, salty and alkaline taste. Effervescent forms are better tolerated, meaning KCl tastes harsher and HCO3 is easier to take orally. Thank you. Have a wonderful day.